Today we'll be looking at observational study designs. So objectives for these sessions are to, number one, are to define and characterize observational study designs, and then identify and differentiate types of observational studies, and then understand the strengths and limitations of each of those observational study designs. So this flowchart shows you a summary of how the epidemiological studies are classified. So broadly, we classify them into observational studies or non-experimental studies. So in this type of studies, the researcher basically just observes what, like various characteristics of their population. In experimental or interventional studies, however, the researcher usually gives like an intervention, say a drug or a type of surgery to one group and maybe not the other, and then they observe differences. So observational studies are then first classified as population-based, where we look at a certain population as a whole. So maybe a country, a region, say East Africa or Sub-Saharan Africa, and they can either be descriptive, so we just describe the characteristics of that population. So say age, gender, occupation, some of the common diseases that they have, for example, and these are also called health surveys, or they could be analytics. So we try and identify a relationship between some of the variables of that data. So if it's a relationship between maybe age and occurrence of a certain disease, or occupation and occurrence of a certain disease. So those are population-based observational studies. We can also have individual-based observational studies. And here now, instead of looking at the population as a whole, we look at specific individuals within that population. So individuals who possess certain characteristics that you're interested in. So they can be descriptive or analytic. And just as you've said, descriptive is where the researcher just looks at the characteristics of that individual or that group of individuals and just describes what they're seeing. And then analytic, they try to see the characteristics and sort of correlate them and see if there are any associations between various variables. So descriptives can either be case reports, case series, or we can also have descriptive cross-sectional studies. And then analytic ones are either analytic cross-sectional studies, case control studies, or cohort studies. And this is what we'll basically be looking at today. And then in next week's session, we'll be looking at experimental study designs, which are broadly classified as randomized controlled trials or clinical trials, and non-randomized trials, so like quasi-experimental trials or field trials or community trials. Okay, so we first start with descriptive study designs. So what are they? They're basically a type of research or a type of study that's used to systematically describe a population, a situation, or a phenomenon within members of a certain population. And it answers the questions such as what, where, when. And we try to answer these questions without manipulating variables or exploring causality. We're just trying to describe. So if it's so if it is a study, for example, to assess the prevalence of hypertension in adults aged 30 to 60 in Kenya, we'll basically just what are we trying to answer? The prevalence of hypertension, where Kenya, when in a certain period of time. And so we're just saying, for example, 30% of Kenyans were found to have blood pressures within a certain range. So we do not really manipulate variables. We're just trying to describe whatever the data collected or the population of interest, whatever its characteristics are. So before we continue, and with the background we got from last week's session on an introduction to study designs, I'd like to engage you to help me identify some of the study designs that I'll be presenting here. We have 4 examples. So once I project, you can just let me know in the Q&A platform what type of a study design you think it is. Okay, so the first example, a group of 1,000 individuals with no known heart disease is followed over 10 years to assess whether those with high cholesterol levels at baseline are more likely to develop coronary artery disease. So what type of a study design do you think this is? Let me know in the Q&A platform. Okay, good. So thanks for the responses. I'm seeing prospective cohort study. So this is correct. So broadly, it's categorized as an observational study, and we're calling it prospective because we are following the individuals up over a period of 10 years. So in future prospective cohorts, because we have like a group of individuals whom we do not really, who do not possess the outcome of interest, so like no known heart disease or coronary heart disease or coronary artery disease or whatever, but then they have a known exposure, which is high cholesterol levels at baseline. So we look at it in more detail, but that's a prospective cohort study. Good. Then the second example, doctors at a pediatric hospital report on 5 cases of a rare neurological disorder observed over the past year. They describe the age, symptoms, and treatment outcomes of each child. So what study design do you think this is? Thank you. So this is a case series. So we have 5, so more than 1 unique cases of a neurological disorder, and we're basically describing in detail the symptoms of each of these patients, so their age, their symptoms, and the treatment outcomes. So case series. Next example, researchers want to estimate the prevalence of hypertension among adults aged 30 to 60 years in an urban area. They select a random sample of 800 residents and just record their blood pressure at a single visit. So which study design do you think this is? The Q&A platform, it's where the answers are being posted. Okay, good. So this is a cross-sectional study. So we are looking at a random sample of a population in a specific urban area, and we are looking at the prevalence of hypertension at a single point in time. So it's like a snapshot of the prevalence of that disease at that particular time. So this is a cross-sectional study. Okay. And finally, a study investigates whether a history of smoking is associated with lung cancer. Patients diagnosed with lung cancer in a major hospital are compared with similar patients without lung cancer in terms of their past smoking history. So what type of a study do you think this is? Okay, good. So this is a case control study. So we have one group of study participants who have an outcome of interest, in which case this is lung cancer, and we have an almost similar group of patients who do not have the outcome of interest. In this case, they do not have lung cancer, and we're trying to compare them in terms of their past smoking history. So whatever exposures that they've had in the past. So this is a case control study. So we'll be looking at this in more detail. So in case it's been a bit confusing for you, don't worry. By the end of the session, you should be able to differentiate the study designs well. Okay, so now we'll look briefly at some of the characteristics of descriptive studies. So number one, as we said, then non-interventional. So in descriptive studies, we do not interfere with what's happening. So there's no intervention, no drug, no surgery that we do. So if you're studying the rates of anemia in pregnant women, for example, we do not give any supplements. We just observe and record maybe the number of patients we saw, the number of pregnant women we saw who had anemia and those who did not. Yeah, so there are also observational. So we just observe and document facts as they occur. So for example, if we notice patients in one ward have more post-operation infections, we just record those observations without necessarily changing care routines. And now the observations that we'll record will now form the basis for maybe a change in intervention or care routines in future. Yeah, or further studies to qualify that change. Then they also quantify occurrence. So descriptive studies are great for measuring how often something happens. So for example, what percentage of children under 5 are fully vaccinated, or how many adults smoke daily. So it's just about counting and describing whatever data we're getting, not really testing relationships. Then they can either be cross-sectional or longitudinal. So cross-sectional, just a study done within a specified period of time, just like a snapshot at that time, or they can either be longitudinal, like tracking malnutrition rates in a community every 6 months for maybe 5 years, something like that. And then, as we mentioned earlier, they can also be individual-based or population-based. So they can range from a single patient case report, for example, the first case of monkeypox in a hospital, to large surveys involving thousands of people, like national health and demographic studies. And then they are also used for hypothesis generation. So descriptive studies help us spot patterns and generate questions. So for example, if a study shows high rates of diabetes in urban areas, it may prompt future research into possible associations for this high rates of diabetes in urban areas. So is it urban diets? Is it maybe high stress levels because of the nature of work? So it just helps us to create hypotheses for future research. Yeah. And then another characteristic which is an advantage is that they're cost effective and time efficient, especially compared to experimental studies. So they're often quicker, cheaper, and ideal for public health screenings, student research projects, or even initial studies in under-resourced settings. Sorry. So now we look at various types of descriptive studies. So we'll first look at case reports. So they are usually detailed narratives of one patient that cover their symptoms, like maybe unique presenting symptoms or diagnosis, treatment, how they responded to treatment, and in some cases, follow-up even after treatment. They often highlight rare or unusual conditions. So, for example, an example is this case report that was published in ECAJS on April 1st. So it's reporting a unique case on gangrenous colon in a congenital diaphragmatic hernia in a patient who was 23 years old. So they basically describe this unique case and how the patient presented with respiratory distress and intestinal obstruction. And this was caused by the transverse colon being trapped within the diaphragmatic hernia. So they describe how the patient presented, what was unique about this case. So basically the colon being trapped within the hernia. And then they also explain how they approached treatment of the case. So emergency laparotomy and colostomy. And then they say how the patient responded to the treatment. So they had an excellent outcome. So case reports have their own advantages and disadvantages. So we'll first look at the advantages. So they're especially useful when a clinician encounters something unusual or new, like a patient presenting with a rare disease or an unexpected reaction to a medication. So this allows us to highlight rare findings that may otherwise go unnoticed. Yeah, so they lead to early recognition of emerging conditions. They can also be a great way to generate new ideas. So for example, if you report a rare side effect from a new drug, other clinicians may start to look out for the same thing. So it may lead to generation of new ideas and maybe treatment options. Yeah, it is also low cost and quick to compile. So because it focuses on one patient and their presentation, case reports are relatively quick and inexpensive to write up and publish. And so they can be a good option for student research or early career academic work. Its disadvantages include that there's no control or comparison group. So you basically just have one data point, which means there's no way to know if you're observing, if whatever you're observing is just a coincidence or part of a larger trend. So without a control group or a comparison, you can't really say what caused what. Was it the disease itself, the treatment, or was it something else entirely? So it cannot really help us determine prevalence or causality because it's just based on one data point with no control or comparison group. Again, because of that, because it's just based on one person, there may be a high risk of bias or overinterpretation. So you may not really be able to determine causality. It is also not very generalizable, and you're prone to writing or like overinterpreting the situation based on how the patient presented. Then next we look at case series. So a case series is just a group of case reports that usually involves multiple patients with similar diagnosis or treatment. So anything upward of one case is considered a case series. The upper limit is usually debated upon a lot. Some people say 30, 20, depends on a number of factors. Yeah, then case series, because they're based on more than one individual, they can help us identify patterns or trends across cases better compared to a case report. So an example here is a paper that was published in JOKAP, the March issue of JOKAP. It's a case series of 2 patients on prosthetic valve thrombosis treated with IV thrombolysis at a tertiary teaching hospital in Nairobi. So here the patients had valvular heart disease, secondary to rheumatic heart disease, and they had undergone valve replacement surgery. However, post the surgery, they had gotten thromboembolism around the valve, and diagnosis was a bit of a challenge, complicated again by some of the other diseases they were having around the time the case report was taken. So like one was having menorrhagia, so that caused discontinuation of offering. And then another got some dehydration and acute gastroenteritis while on warfarin. So it prompted like tapering down of the dose. So the doctors were keen enough to notice the thromboembolism, diagnose it very fast, and initiate anticoagulation with fibrinolysis to help reduce that risk or eliminate the risk of thromboembolic complications entirely. Yeah, so they basically reported on the occurrence of thromboembolism and how both patients responded well to treatment with intravenous thrombolysis. So with a case series, unlike a case report, we take things a step further by describing multiple similar patients, which help us identify patterns. So it can reveal early trends or adverse events a bit soon. So for example, if 10 patients develop the same complication after surgery, it might prompt us to investigate whether a particular technique or drug is helpful. Then it also helps build evidence for hypothesis formation, especially in situations where diseases are too rare for large studies and we need like quick early insights. So for example, during a disease outbreak. Yeah, so they help generate hypotheses and just get initial data into rare diseases when like other larger studies like RCTs are not really feasible. However, just like the case report, case series lacks a control group, so it doesn't tell us how common the condition is so it doesn't really tell us how common a condition is or how generalizable it is to to the population. So we have limited validity in terms of generalizing the conclusions to our population. Then it's also susceptible to selection bias, where researchers might select only the most striking or accessible cases, so introducing bias. So while it is more informative than a single case, it still can't give us firm conclusions about risk or cause. So then we look at descriptive cross-sectional studies. So a descriptive cross-sectional study is a type of observational research that measures and describes the distribution of a variable or health condition in a defined population at a single point in time or over a short period of time. So like over 1 year, 2 years, or maybe 5 years. It can be it can be retrospective. So you look back at, for example, health records over a period of time, and you try to describe the distribution of various variables or health conditions. So it mostly focuses on answering questions like what is the prevalence, who is affected, and what are some of the characteristics of those who are affected. To note, however, unlike what we will see in analytical cross-sectional studies, descriptive cross-sectional studies do not test as associations or hypotheses. They only describe what is observed. So here we have an example from the Annals of African Surgery. It's a study on clinical pathological characteristics and surgical interventions of, among some patients who had colorectal cancer. Yeah, so as you can see in this case, it was a retrospective study done in King Abdulaziz Hospital. Here data were obtained from medical records of patients who underwent procedures and were diagnosed with colorectal cancer. You can see over a period of around 8 years here, from 2015 to 2023. So even from the results, we can see they're basically just describing features of the participants who are enrolled in the study. So there were 204 participants. They've described the distribution of sex, so 52.5 were male. Most of them were greater than 45 years. They've described some of the symptoms, the duration of symptom onset. Yeah, so based on those who had the cancer in the cecum, the descending colon, and the transverse colon, and then the approach. So was it surgical? Was it palliative therapy? So they're not really testing associations. They're just telling us the characteristics, the clinical and pathological characteristics and surgical interventions that were done to this study participants were included in the study. Okay, so what are the advantages? So cross-sectional studies are perfect for taking a snapshot of a population, and they're great for estimating prevalence. So for example, finding out how many adults in a city are hypertensive at a given point in time. They're also fast and relatively cheap, simple to conduct, which makes them especially useful in resource-limited settings or for large sample sizes. Disadvantages. They usually can't tell us of the temporal relationship between variables, so we can't tell what came first. They're also poor for studying rare conditions, and we cannot infer causality from them. So the last type of descriptive studies are ecological studies. So ecological studies are unique because they use group level data or aggregate data to explore relationships between exposures and outcomes across different populations or regions. So, for example, we can compare country level sugar consumption. So maybe sugar consumption in Kenya, in Uganda, in Tanzania, and then we compare that with national diabetes rates across Africa. So here we're looking at large population-based data, but then we are grouping them into categories. So in this case, based on the country. So they're usually great for spotting large-scale patterns. So for example, if countries with higher processed food or high level sugar consumption have high obesity rates, that may raise important questions that may prompt further research. However, the main limitation is something called the ecological fallacy. So this means we might mistakenly assume that what's true for a group, so say what's true for, based on the data we got from a certain country, is also true for each person within it, which is wrong, which is a limitation. So for example, just because a country with high alcohol consumption has a high liver disease rate doesn't mean that every person with liver disease drinks alcohol. Yeah, also these studies often don't account for confounding variables like other differences between populations that might explain the trend. Yeah, so far we've looked at observational studies. So we've looked at ecological studies and all of the descriptive individual-based studies. So case reports, case series, and descriptive cross-sectional studies. So now we'll take a 1 minute break, and then when we come back, we'll finish off by looking at analytical study designs. So I think we can continue. So analytic study designs, unlike descriptive study designs, in analytic study designs, we'll be trying to find an association between various variables. So say like a link, not really causality, but just an association. So analytical studies are can be observational or sometimes interventional studies that aim to test hypotheses by examining the relationship between an exposure and an outcome. So they go beyond describing to determine whether an association between variables exists, and sometimes to estimate risk or causal links. So you can think of analytical studies as asking, are people with X more likely to have Y? So, or does X lead to Y? So that is causality, may not entirely be possible with an analytical study, but think of it more of, are people with X more likely to have Y? So people with a certain condition, is a certain variable may be associated with another, and we look at examples to cement this better. So what are some characteristics of observational analytic studies? So number one, they involve comparison groups. So analytical studies are structured to compare groups. So for example, like in cohort studies, we follow people who are exposed to something and compare the outcomes with those who are not, or in case controls where we compare people with a disease to those without it to see what differs between them. They also aim to identify associations or causation. So the goal is to figure out whether an exposure is linked to an outcome. So for example, does smoking increase the risk of lung cancer? So they just help uncover potential causes or associations between variables. They also use statistical testing. So to interpret the findings, we use statistical testing. So like risk ratios, especially in cohort studies, odds ratios in case control studies, or more advanced models like regression to help adjust for other confounding factors, just so that we establish the strength of association between various variables. Then they can be retrospective or prospective. So some analytical studies look backward in time. So retrospective, using past records to examine exposures and outcomes. And then, so for example, case control studies, and then others follow people forward from exposure to outcome. So for example, in cohort studies, then analytical cross-sectional studies can be either way. Yeah, so then we said the observational. So we look at the first observational analytical study, which is cross-sectional analytical studies. So they're observational. They measure the exposure and outcome at the same time, and they're usually conducted in a defined population, which is usually a general sample, not just those at risk. And then they also help identify associations, not really causation. And they're useful for assessing prevalence of disease within certain populations. So we look at this example. It's a cross-sectional analytical study, was published in JOKAP March issue. So it's assesses mortality and associated factors in end-stage renal disease patients admitted at Kenyatta National Hospital from 2017 to 2021. Yeah, so we can see there's a specified period of time that you're looking at, and then so in this case, this was a retrospective study, so where records were examined like backward. Yeah, then data was extracted, and in as much as there were some descriptions of how the study participants were distributed, like 60% of the patients were male, median age was 52. There's also an attempt at identifying some of the associated factors, some of the characteristics of population with end-stage renal disease that were associated with mortality. And so they found older age, male gender, rural residence, lack of medical insurance, hypertension, using a catheter for dialysis access. So all these factors were associated with higher mortality in patients with end-stage renal disease. So they tried to sort of study associations between those features and mortality. So what are their advantages? So they are quick and relatively cost effective, since we collect data at once and there's no need to follow patients over time. And then it can also be useful for studying multiple exposures and outcomes simultaneously. So for that reason, they are versatile. They're good for generating hypotheses, so spotting patterns or associations that can be explored further with stronger study designs. On the downside, however, they cannot establish causality or temporal relationships because the exposure and the outcome are measured at the same time. So we don't know which came first. Yeah, and for that reason, they are also very prone to confounding and selection. So to confounding, because there are many exposures that could basically influence the outcome at one point in time, and we're not really able to tell what caused what. Then they're also prone to selection bias, which can distort the associations we observe. They're also not very ideal for rare exposures or outcomes because it's just a snapshot at one point in time. So we stand a risk of missing out on maybe rare cases or rare exposures entirely. So next we look at case control studies. So case control studies are a type of observational studies that compare two groups of people. So number one, those with the disease or condition under study, these are called cases. And then a very similar group of people who do not have the disease or condition, and these are called controls. And now participants are stratified based on the outcome. So cases have the outcome, controls do not have the outcome. And then now after that stratification, researchers now study either the medical or lifestyle histories of the people in each group to learn what factors may be associated with the disease or condition of interest. So for example, one group may have been exposed to a particular substance, so maybe smoking. and the other was not. So this is an example of a case control study. So it's published in Annals of African Surgery. So titled Risk Factors for Esophageal Squamous Cell Carcinoma in a Kenyan Population. So in this case, the outcome of interest was presence of esophageal squamous cell carcinoma. And so they were analyzing the association of esophageal squamous cell carcinoma with smoking, cat chewing, alcohol, diet, socioeconomic status, and all those other variables in a matched case control study. So the cases had the outcome of interest, which was esophageal squamous cell carcinoma. The controls did not have the outcome of interest, but they had like almost like similar exposures. Yeah, so the cases were matched in a ratio of 2.1 to 1. And after the analysis was done, it was noted that caustic ingestion, first-degree family history of esophageal squamous cell carcinoma, and poor housing were independent predictors for who will get esophageal squamous cell carcinoma. Yeah, so starting with the advantages, case control studies are ideal for rare diseases. So instead of waiting for new cases to occur, we start with the people who already have the condition, and then like look backwards and try to identify some of the exposures or risk factors that may have led to them developing the outcome of interest. There are also relatively, okay, they do not require as much resources, especially compared to experimental cohort studies. And then they can also evaluate multiple exposures or risk factors at once for a single outcome. Now for the disadvantages, they may be prone to recall bias. The patients may forget or misreport past exposures. They're also prone to selection bias, especially if controls aren't chosen carefully. The temporal relationship may also be unclear. We may not know like the exact duration, maybe the exposure would have led to development of the outcome of interest. And then we can also not directly measure incidence or relatively risk. We can only do odds ratio. And most importantly, like many observational studies, we cannot establish many confounding variables. We can just like find associations, not really causality. Yeah, so now we move to cohort studies. So in cohort studies, a group of individuals is followed over time to determine how certain exposures affect the occurrence of outcomes. So they can be prospective, looking forward in time, or retrospective, looking back using existing records. So the image on the right just illustrates two types of cohort studies. So it may be either a prospective cohort study, so where we start in the present and follow participants into the future to see who develops the outcome. So in case control studies, we were looking at an outcome of interest and then following patients backward to see what exposures might have predisposed them to getting the outcome of interest. In cohort studies, however, we have an exposure of interest. So we start a study having identified a certain like exposure. So we then divide the study population or stratify it based on the exposure. So the exposed group or the unexposed group, and then we follow them into the future to see who develops the outcome. Yeah, and then there's also retrospective cohorts, although these are usually a bit controversial, where we look back into existing records, tracing from exposure to outcome based on historical data. So the key difference between the two is in when the data is collected relative to the timing of the exposure and the outcome. Yeah, so there, as we said in cohort studies, the population is first split into exposed group and unexposed group, and then each group is now then followed to observe whether they experience the event. So for example, develop a disease or not. Now, because we start with the exposure status and then observe outcomes over time, cohort studies help us understand how an exposure may lead to a health outcome, something case control or a cross-sectional study can't do as clearly. So what are some of the advantages of cohort studies? So they help establish a temporal sequence between the exposure and the outcome. This is one of the biggest strengths of cohort studies. So we start by identifying who was exposed and who wasn't, and then follow both groups over time to see who develops the outcome. So they make it easier to suggest that the exposure came before the outcome. So a key step toward understanding causality. Then they can measure incidence and calculate relative risk. Since we follow participants over time, then you can directly observe new cases of disease, so that's incidence. And then because you're comparing the exposed and unexposed group, we can calculate relative risk, which tells us how much more or less likely the disease is in one group versus the other. Then they're also suitable for studying multiple outcomes from a single exposure. So let's say we are studying smokers. A cohort study allows us to track many possible outcomes from that one exposure. So lung cancer, heart disease, stroke, COPD, all in the same population. Then they're also better for rare exposures. So if an exposure is uncommon, like say a specific occupational chemical, it would be hard to find enough exposed people in a general sample. So in a cohort study, we start with people who already have that exposure, making it easier to study them over time. On the downside, however, cohort studies can be time-consuming and expensive, especially prospectively, because in prospective cohort studies, we wait for events to happen in the future, which can take a long time, sometimes years or decades, and involve costs of tracking, testing, and maintaining participant contact. They're also not efficient for rare outcomes or diseases with long latency periods. So if a disease takes a very long time to appear or is very rare, you might follow thousands of people for years just to get a few cases. So this makes them quite inefficient and costly compared to something like a case control study. And then the other challenge with cohort studies is that you may have loss to follow up, which may introduce bias. So people may move away drop out or even just stop responding to the researchers. So if those who drop out are systematically different from those who stay, for example, if sicker people leave the study, then the results gotten from that may be skewed. Yeah. Then in the case of retrospective cohorts, there's reliance on accuracy of past records. So where we look back at existing records to find exposure and outcome, but if those records are incomplete or inaccurate, it may introduce misclassification bias and limit the study's validity. Yeah. So basically that's what we've covered. So just a recap of what we've done. So epidemiological studies, for us to be able to classify them, then we need to ask ourselves, one, does the study describe the characteristics of a sample? For observational studies. So does the study describe the characteristics of sample? Is it population-based or is it individual-based? Then does it simply describe the characteristics of the sample or individual, or does it attempt to analyze or draw inferences about it? So if it just tries to describe, then it's a descriptive study. And if it tries to analyze or determine associations or draw inferences from the data, then it's analytic. If it's analytic, did the investigator determine the exposure? If no, then that's an observational study. If the investigator determined the exposure, then that is an experimental study. So those we'll look at them in next week's session. So if they just observe that it's analytic, then it falls under either three of these categories. Yeah, so then now if it's observational, when was the outcome determined? Was it at the start of the study? So if it was at the start of the study, then that's a case control study. Was it at the end of a period of follow-up? Then that would be a prospective cohort study. Or was it simultaneously? So was the outcome and the exposure determined simultaneously? Then that is an analytical cross-sectional study. Yeah, so that's basically it from me. These are my references. Thank you for your attention. I'll now take any questions.